with us is patient, or rather our guest, Mr. Vic Manocchio.
Hi.
How are you doing?
Very good.
So tell me, what are you doing here at River Health System?
I put it in a nutshell. I was around my house and went to get a cup of coffee one morning and looked at and something had popped up on my elbow that when I went to an orthopedic surgeon, found out it was called pleomorphic liposarcoma. And then I was informed how bad it really is, and went to see an orthopedic oncologist, and the orthopedic oncologist referred me here and set up appointments with Dr. Greenfield.
And how's your experience been so far?
I'm very pleased. More pleased than you can possibly imagine. I worked on fire rescue in Dade County, Miami-Dade County for 30 years, and I saw it many, many times. My doctor told me this, and this is what I'm going to do, and they never answer the question. And I'm not blowing smoke. Dr. Greenfield and Dr. Gatewood have answered every question and made it more tolerable.
So what exactly does this treatment do to lesions and tumors in the body?
So the whole point of the radiation is to get rid of it. So same thing with chemo, same thing with surgery, is to completely eradicate the tumors if we're going for a definitive curative approach. If it's a palliative approach, more of it is just to shrink the tumors away to make patients feel better. About 50% of patients do get radiation at some point during their treatment. So it's either to make them feel better or to actually cure, either way. A lot of people think it's a scary thing, radiation, but really it's not. It's like getting an x-ray. Patients just sit on a table, the machine goes around them, energy is delivered just like a regular x-ray. You don't see it, you don't feel it, it goes inside of you, except we use a lot higher energy, we can shape it to wherever we want. So with the technology we have here, which is very precise, we can shape that within millimeters of accuracy to make sure that it's going just to the tumors and to nowhere else, avoiding all the vital structures in the body.
It's only a 10-15 minute treatment. It doesn't hurt. It doesn't. Every time I go home, my wife will say, "Well, how did it go today?" I said, "Fine." She said, "Let me look at it." I said, "It didn't change. It's still the same thing." However, it has. This is after 9 treatments. I put on a shirt that I could not get over my arm when this thing had started swelling up. I am now, the tumor has shrunk, and that's a bad word because, I found out from Dr. Greenfield it's actually, the radiation kills it, and it's shrunken or gone back 2 or 3 centimeters on each way.
That's excellent. Right?
Yes. So preparing me for an operation.
Well, we wish you the best, Mr. Manocchio.
Thank you.
And thank you for sharing your story with us.
Yes, thank you.
I love my patients and I like to see them as much as possible, but I want to see them out there enjoying life. I don't want them in here. So my goal is both quantity and quality. Without both of those, it doesn't make that much sense. So quality is very important to me. And quality for me is you being outside the hospital and not seeing me every day.
Excellent. Well, he's right. Our core value number 2 is quality means everything. Thank you for joining us for this Mission Monday, and thank you, Dr. Brad Greenfield, for being on.
Thank you.